And then I'll begin screen share here. Okay, stand by. Whoops, wrong one.
Yeah.
Let's get the other.
At least it's an agenda item.
Yes, okay, there we go. Get us back to the top. Okay, we're live and running.
All right, good morning, everyone. This is Wednesday, September 8th. It is 10:03 a.m. and this is the regularly scheduled meeting of the Lincoln County Board of Commissioners. We are meeting virtually and we are live streamed on YouTube. First item on our agenda is to call a meeting to order, and I now have done so. Next, we establish a quorum. We have all three commissioners present, which does constitute a quorum. Next, we have three resolutions for adoption today, and each of the commissioners is going to read one. The first one we'll discuss is the 2021 Suicide Prevention Month. Commissioner Hall will read that, and then we have some individuals to provide some comments. So Commissioner Hall, you're muted.
Thank you, Chair Hunt.
You're welcome.
In the matter of declaring September as Suicide Prevention Month in Lincoln County. Whereas September 2021 is National Suicide Prevention Month, when millions of people around the world join their voices to share a message of hope and healing. And whereas in these challenging times, messages of hope and healing are more needed than ever, and whereas every day in Lincoln County, people enter treatment into behavioral health services and community supports and begin the road to wellness, and whereas resiliency begins early in life within families, daycares, and schools, and can be strengthened and reinforced throughout the lifespan, and whereas wellness encompasses the whole individual, including mind, body, spirit, and community, and whereas the benefits of preventing and overcoming mental health challenges, suicide attempts and loss, and substance abuse, excuse me, are significant and valuable to individuals, families, and our community at large. And whereas it is essential that we educate residents about suicide, mental health, and substance abuse problems and the way they affect all people in the community. And whereas we must, And whereas we must encourage relatives, friends, co-workers, and providers to recognize the signs of a problem and guide those in need to appropriate services and supports. And whereas Suicide Prevention Month inspires millions of Americans to raise awareness, build resiliency, and find hope. And now, therefore, be it resolved by the Lincoln County Board of Commissioners, hereby proclaims September 2021 as Suicide Prevention Month, finding hope, building resiliency, supporting recovery.
Thank you, Commissioner Hall. And we have two fine representatives from our Health and Human Services Department to provide some comments. Linda Gray and Sarah Hurd, welcome. I'll let you decide who goes first.
Well, if it's all right, Linda, I will just start by saying all month, mental health advocates, prevention organizations, survivors, allies, community members unite all across the United States and here in Lincoln County to promote suicide prevention awareness. So there is a lot of effort in making sure that people have the resources that they need in our community, that they have the education, that they can understand and recognize some of those warning signs, how to talk to people about how they're doing, because we know that if people get the help that they need, they may never be suicidal again. So it's important that as a community that we help provide that support to individuals. Through our school districts, all of our teachers and staff have been trained throughout the last year. At the beginning of this school year, all of our food service staff, school bus drivers, janitorial staff have all received suicide prevention gatekeeper training. And then just last week, was able to do a training for new staff members. So it's important that we continue this education, provide those resources and support. So I would just like to say on this call that if somebody needs to reach out, Suicide Prevention Lifeline is as simple as dialing 1-800-273-TALK or 8255. So I'm wondering, Linda, if you want to talk a little bit about some of our efforts at our local behavioral health department.
I sure would. First of all, I'd like to address some percentages of annual prevalence across the United States that I think are really important. 4.8 percentages of adults have serious thoughts about suicide. 11.8 young adults from the ages 18 through 25, 18.8 of high school youth have serious thoughts, and 46.8 of our LGBTQ population have serious considerations and thoughts about suicide. Highest rates of suicide are in Hispanic and Indigenous communities. LGBTQ youth are 4 times more likely than straight youth. Transgender, 12 times more likely than the general population. And it is the leading cause of death in local jails. I would like to talk about, we did provide a postvention, what we call a postvention training for our community. It was a community-wide training. That was the last week in June. We will be doing that again. And what that does is it brings people together to be able to allow people to think about how we're going to be proactive for the next time we may have something come up. And hopefully eventually what we do is we're in prevention hand in hand with Sarah, so that we're not having to deal with things that happen, but can deal with things before they happen. So we'll be having more of those trainings probably in the next couple of months or so. I would also like to mention the Trevor Project, which has a focus on LGBTQ for support and crisis prevention and intervention. I think it's a very important project that's going on right now. I also have a teen-to-teen text, which I might add, which is, it is teen to teen. So it's a number 2, not the letter 2. And it's 839-863. Thank you.
All right, thank you. Questions or comments from commissioners?
Chair Hunt,
Commissioner Hull.
I really appreciate the presentation. I really appreciate the opportunity for us to bring a little bit of the spotlight to the problem of suicide with this proclamation. I've been working and advocating on health issues of all kinds for nearly 20 years, including mental health. And while I think we have made great strides in lessening stigma attached to mental health issues, that stigma is still there, which sadly, tragically sometimes prevents people from reaching out for needed help. So I just hope this is one more opportunity to share the message that even though things may seem hopeless at the moment, that they're not, that there are caring professionals out there who can provide help and hope. And glad that Lincoln County Behavioral Health is playing such an essential role in the community in doing that. Thank you.
Thank you. Commissioner Jacobson?
Yeah, I have 2 comments to make. One is just hoping that maybe we can work with our PIO, Casey, and make sure this gets out into local media, and really those phone numbers, I think, are most important thing. The proclamation is nice, but I think it's the phone numbers that are most relevant. So let's make sure we get those out. And, I just wanted to kind of do a shout out to families and, and friends, because I had postpartum depression, excuse me, with one of my babies, with my first baby. And I had such a lack of awareness about what I was going through. Never been a mom before, never had a baby before, never had depression before. And it is so, so easy to be in a depressive situation and not know it and not understand that you need help. I think sometimes that stigma that Commissioner Hall was talking about, it's not just that you have a stigma, you don't want to reach out for help. It's that you don't know, you don't have the awareness. I generally think of myself as being someone that's pretty in tune with myself, but I had zero awareness that I was in trouble, especially because, like I said, new mom, new situation, just thought this sucks. This is how it is. And I just kind of need to get through this, not really having that awareness that I was in trouble and that wasn't normal. In fact, it wasn't until later, until I had my second baby and didn't have postpartum depression, that I kind of went, oh, I was in trouble. But luckily it was my mom and other people I knew that had been moms that did sort of point out to me that the feelings and thoughts I was having were not normal, even though I didn't have the awareness, they did. And that really helped. And so, I just want to say that it's often other people around that person, not the person themselves, that needs to sort of be paying attention and bring that awareness. And that's not always an easy job to have as a family or friend to say, you're in trouble. Because I know what my response was. My response was, no, not, I got this. And so, I just want to get a shout out to the community and friends and family that it's a lot of times on your shoulders to sort of have that awareness and do something and try to convince that person that, that they need help as well. So just in the interest of not having stigma, I just wanted to share my own story and let people know that, it happens to everybody.
And I'd just like to say really quick that currently right now we have two teens in acute care from suicide attempts, and school hasn't even really started yet. So it's really important that that awareness is there and that we're being really vigilant around our teens and their needs and everybody. But where my heart is, child and family. So. And I do have extra phone numbers. I can send those to Casey if you'd like, so he can get those out.
That would be good.
Yeah.
Okay.
Let's do that.
Thank you.
So I may have missed this, but I think it's probably worthy of repeating if I did, but can you quickly highlight some of the signs of, suicidal thoughts? So what might be some triggers for people to be aware of that might lead them to seek help?
Yeah, thank you. That's a great question, Commissioner Hunt. So suicide occurs in a context, and understanding what that context is really important. We know that about a week preceding a suicide attempt, people often communicate what their plans are. That communication is going to come in different forms, whether it's verbal, a direct statement where they may say, I've decided, I have a plan, I'm going to end my life, I'm going to die by suicide. Might be indirect. They might say something like, you don't have to worry about me anymore, I'm not going to be around anymore. It might be their behaviors. You might see a change in behavior in somebody. They become all of a sudden very irritable, very depressed, giving away personal items. So they might communicate in that change in behaviors. It might be situational, and we've all been in a situation over this past year that's caused tremendous stress. So we want to be looking for those changes in individual, listening to what they're saying and understanding the context, and then having that conversation. Not everybody we talk to is going to be suicidal when we see those changes. Somebody might just be stressed to the breaking point and they need other help. And they may tell you that they are feeling suicidal. You're not going to put the thought into somebody's head if you ask them about it. They either are or are not thinking about suicide. So when you see these kind of warning signs, or you see that something seems different and you have that conversation, then you can be able to get a better understanding of what's happening and then get them referred to help. Tell them that you care about them. Tell them that their life is important to you. They're going to get through this together. That thought about suicide is a permanent solution to a temporary problem, and we can help them find another solution to that problem.
I think that's a great point that you made, and something that I hadn't thought about, but don't be afraid to ask somebody if they're considering suicide. If they aren't, you're not going to trigger the event, if I understood you correctly. And therefore, by asking and creating an awareness, you can affect the person getting help. So excellent point, one that I hadn't considered. Any other comments or questions from commissioners or Sarah or Linda? All right, I'd be happy to entertain a motion. Thank you, ladies, very much.
Mr. Chair, I would move that we approve this resolution declaring September as Suicide Prevention Month in Lincoln County.
And I will second that motion.
Moved and seconded. Any other discussion? All those in favor say aye. Aye.
Aye.
Aye.
That motion carries. And again, thank you. All right, we'll move on to our second resolution, and that is declaring, let's see, make sure I got the right one here. Reading from the okay. This is a resolution declaring 2021 as National Preparedness Month. I assume that would be the month of September. And we have with us our Manager of Emergency Services, Jenny Damaris, and Assistant Emergency Manager, Jess Palma.
Hi, good morning, commissioners. Yeah, first of all, I would like to welcome our new Assistant Emergency Manager, Jessica Palma. She comes to us from our Public Health, Health and Human Services family. So that was a great transfer for us here in the Emergency Management Division. And thank you for allowing us some time on your agenda to talk about National Preparedness Month. We too have a proclamation that we've put together for you for this month. It is a national campaign, so everyone is focusing on those same areas across the nation. And I'll just take a quick little bit of time here to talk about, so the first week, September 1st to the 4th, which was last week, it was really all about making a plan. Many family members and individuals have plans kind of in place. So if you do, that's great, but it's always a good time to just, take a look at that, make sure it's up to date if things have actually changed, and build a kit. Always trying to encourage folks to build a kit, and it's not just one kit, it's a kit to evacuate immediately, as we saw in the Echo Mountain Complex fire, where those individuals in the city of Lincoln City had to evacuate rather quickly. It may be for a distant tsunami where you are just taking your car and your vehicle out of the area for the day until it's safe to go home. It could be a Cascadia event where you know you're evacuating from your house for several days, if not weeks. And what can you carry with you, because you will be on foot? Also having that kit in your car. So yourself and your family that travel with you. I know my grandparents tend to haul my kids around, so I always make sure that they have extra items in their car for the grandkids wherever they're going. And then also pets. If your little Fido, or sometimes your kitty cat, or whatever pet you may have goes with you in the car, make sure you have those necessary items for them as well. And then the next week, September 12th to 18th, is low cost, no cost preparedness. So this year, the National Preparedness Month is really focusing on those things that are not very expensive, smaller items, or how you can sort of build up your kit if you haven't already taken time to do so. And then the last one is, this one's kind of unique. This is the first time I've really seen them call out the younger group of our community. September 19th through 25th is Teach Youth About Preparedness. Now, we know our Lincoln County School District and our charter schools do a really great job of educating and preparing our children and their family members with preparedness. But this is just giving that extra little something to focus on that specific youth group to help them sort of put things in their terms to build that foundation as they become young adults and carry on about their own, to build that foundation for their own personal and family preparedness. We have lots of offerings of our wildfire readiness videos that we created this early summer that still carry over for all hazards event. On our webpage, we've added more additional resources for webinars that were made available by FEMA and their team. So there's some new information there. It's not just about what we create. There's a lot of really great resources available from our federal partners. And then lastly, I would leave it to you as the commissioners for the proclamation, and thank you very much for promoting this.
And thank you, Jenny. I guess I'm keeping everyone on their toes. So Commissioner Jacobson, would you like to read the proclamation after Ms. Demers' comments?
Yep, I will go ahead and read it right now if everyone's ready. All right, in the matter of declaring September as National Preparedness Month in Lincoln County, whereas National Preparedness Month occurring annually in September since 9/11 creates an ideal opportunity for community members, businesses, and visitors of Lincoln County, Oregon to join other community members across the United States in preparing their homes, businesses, and communities for any type of emergency, including natural disasters. And whereas the U.S. Department of Homeland Security and other federal, state, and local officials in the private sector are working to prevent and respond to all types of emergencies. And whereas when individuals take responsibility for preparing their families and their communities, the chance of survival and return to normalcy following a disaster is greatly increased. And whereas the Lincoln County Sheriff's Office Emergency Management Division partners with federal, state, local, tribal, territorial, private, and volunteer agencies to inform individuals on how to take action through our public education campaigns and our local volunteer programs, such as Community Emergency Response Team or CERT, American Red Cross, U.S. Coast Guard Auxiliary, Law Enforcement Volunteers, Auxiliary Communication Services, and Medical Reserve Corps volunteers. Thank you, Casey. Whereas residents, businesses, and visitors of Lincoln County, Oregon are urged to plan ahead for disasters and encourage their family and their friends to also do so by participating in neighborhood preparedness activities, registering their contact information in the local emergency notification system, Lincoln Alerts, and participating in annual readiness events. And now therefore be it resolved by the Lincoln County Board of Commissioners, hereby proclaim September 2021 as National Preparedness Month and encourages all community members, businesses, and visitors to develop their own emergency preparedness plan and work together towards creating a more prepared community.
Thank you, Commissioner Jacobson. Commissioner, thoughts or comments, questions?
Yeah, I guess just one thing I would say is not realizing it was going to be National Preparedness Month, but we kind of every year, and you know, I think going through the Echo Mountain fire, even though we didn't have to evacuate, it just kind of gained greater perspective that that absolutely can happen in your community. Our family who have go bags in the car, we have a generator, we have food storage at the house, et cetera, really here recently stopped and did a little pre-walkthrough with the kids of having to get ready and actually leave the house and what people would grab, and actually doing that exercise where we thought we had it all together and had a plan, realized we had a critical element missing, which was we did not have any way to take the beloved guinea pigs with us, Banana, Polka Dot, and Maggie, which was quite distressing to my son, who's 7, when we were doing this exercise, that there was no way to put them anywhere. We hadn't planned for them. So now we do have a guinea pig evacuation plan and a little carrier, and they are ready to go. But my story, I guess, just points out that in our heads, we thought we were totally there. We had it all ready. But when we actually tried to, pretend execute, weren't ready. And like I said, very distressing to the 7-year-old that we would have to leave the guinea pigs behind. So just to note that sometimes it's nice to actually do a little walkthrough and actually think about things in your house and maybe realize that you've missed something.
Commissioner Hull.
Thank you, Chair Hunt. I think our experiences, certainly with the Echo Mountain fire and other challenges, disasters of all types through the years, just point out the need that preparedness is a job that will never be finished. Sadly, it takes something on the scale of Echo Mountain sometimes to wake people up to the reality that disaster could be lurking just around our own corners. But the positive thing is, I think, thanks to many years of good work from our own emergency services program and others in the community who have provided platforms and supports for getting this message out, that awareness is growing, preparedness is growing. And so again, I'm just glad that we can adopt this proclamation.
All right, thank you. I have a couple of observations. First of all, has already been emphasized, preparedness is certainly one of the bigger keys as far as how to be safe in the event of a disaster or an emergency. And I also have a bit of a challenge as far as planning and actually going through the process. Doing it mentally is far different than actually going through the physical process. And I was actually reminded of that as I sat here and remembered that earlier today in the morning, I was up at Toledo High School, and all of a sudden I heard the fire alarm go off. And I realized, well, they're doing a fire alarm drill. And yes, we also need to do evacuation preparation drills. So, there's a reason. And certainly from an emergency management standpoint, we have many exercises that are, in effect, drills, practices that are, I think, a critical part of being prepared. And if I might, for just a moment, I'm going to digress just a bit. The first line of this resolution mentions that we now annually in September have a National Preparedness Month, which was started, frankly, as a result of the 9/11 terrorist attack. And I'll remind everyone that this Saturday is September 11th. It's also the 20-year anniversary of 9/11. And I, like many individuals, I think, remember very clearly that morning when I got up. I was staying at my father's house. I was attending a meeting in Portland. I never turned on the TV in the morning at my father's house. That morning, I did. And I couldn't understand why I saw one of the towers with smoke. And then I learned. So, a day that I think sadly has affected all of our lives, and one that we don't want to forget, and certainly a critical part of why we want to be prepared. So with that, if there are any other comments, if not, I'll entertain a motion. Thank you, Jenny.
Thank you.
I will make a motion declaring September as National Preparedness Month in Lincoln County.
I'll second that motion.
Moved and seconded. Any other discussion? All those in favor say aye. Aye.
Aye.
Thank you. That motion carries. All right. I have the honors of the third proclamation, and I will read it. And my apologies to Commissioner Jacobson for the error in sequence, but I will read this. And it's declaring September as National Recovery Month in Lincoln County. Whereas behavioral health is an essential part of health and one's overall wellness, and whereas prevention of mental and substance use disorders works, treatment is effective, and people recover in our area and around the nation, and whereas preventing and overcoming mental and substance use disorders is essential to achieving healthy lifestyles, both physically and emotionally. And whereas we must encourage relatives and friends of people with mental and/or substance use disorders to implement preventative measures, recognize the signs of a problem, and guide those in need to appropriate treatment and recovery support services. And whereas to help more people achieve and sustain long-term recovery, and learn how recovery positively benefits well-being, the Prevention Coalitions of Lincoln County, PADA, and CEDAR, together with the Confederated Tribes of the Siletz Indians, Lincoln County Health and Human Services, Seashore Family Literacy Center, Celebrate Recovery, Chance, the Lincoln County Sheriff's Office, Reconnections, Discovery Counseling, Samaritan, and many local treatment and recovery support organizations are sponsoring events to celebrate recovery and well-briety during the 31st Annual National Recovery and Well-Briety Month, including virtual trainings and webinars, a social media campaign using hashtag Lincoln Recovers, and multiple small events throughout Lincoln County. Now, therefore, we, the Lincoln County Board of Commissioners, do hereby proclaim September 2021 as National Recovery and Well-Briety Month in Lincoln County and encourage citizens to celebrate recovery, spread the word, and support these community efforts. All right, I believe we have Sarah back with us to offer some comments.
Thank you so much. So National Recovery Month is celebrated or observed every September to educate Americans that substance use treatment, mental health services can enable those with mental and or substance use disorders to live a healthy and rewarding life. This year, the national theme is recovery is for everyone, every person, every family, every community. Millions of Americans whose lives have been transformed through recovery, since those successes often go unnoticed by the broader population, Recovery Month provides a vehicle for everyone to celebrate these accomplishments. Here in Lincoln County, we have annual events which are starting to change a little bit given our prevalence of COVID. So one of the things we were very excited about this year is bringing back Hands Across the Bridge. I just received word this morning, it sounds like that event is being canceled for the in-person event. So we will get that updated on our website and our calendar of events, and we will work very hard and diligently to try to make that happen again next year. I know we want it to come back. The community was very excited about that. And I'm sure Rick Booth would have loved to have talked about that today. We do have a website on the Lincoln County website with events that are posted on a calendar. So we do have some online events. So for example, as part of Recovery Month, Lines for Life is going to do a webinar this Friday telling our resilience story, and that'll happen between 12 and 1:30. There's a link on our website to be able to sign up. There's also an event link on our Facebook page if people are interested. There's several other events. There's a beach cleanup that will happen up in Lincoln City. We'll have next week a webinar for managing organizational trauma or trauma-informed care in the afternoon. There'll be a mental health first aid training by Oregon State University on Monday the 20th. I'll be talking about tobacco cessation and celebrating how hard people who are able to quit smoking and how hard that was. So we'll celebrate that recovery as well. That'll be an online event. Waiting to hear about Reconnections. Was going to have a Taco Tuesday and dance at the Annex, and I think that is not going to be able to happen for safety reasons around COVID this year. So again, we will keep that. We'll keep the community posted. And then it looks like there may be another mask tie-dyeing event with Chance at the end of this month. So we'll get out a press release and we'll continue to look for ways to celebrate recovery and remind everybody that recovery is for each and every individual in a community.
Thank you, Sarah. Questions or comments from commissioners? Commissioner Hall.
Mr. Chair. Yeah, thank you. Well, I think this resolution tells a remarkable story. We've got a strong and thriving recovery community in Lincoln County. government agencies, nonprofits, faith-based groups, healthcare organizations, you name it. And as a result, I think we really do have a thriving recovery community in Lincoln County. I have really been privileged over the last nearly 20 years to get to know a lot of people who are in recovery, and the stories of lives changed, lives saved, lives turned around. It's really quite moving. So I am glad we have a chance to spotlight this important work. Thank you.
Thank you. Commissioner Jacobson?
Yeah, I was just going to say, I really like the theme for this year of recovery is for everybody, because, I have heard people say that's not for me, or my, relative. Nope, that's never going to happen. It's not for them. So I really like this theme of recovery is for everybody, because it is for everybody. Everyone deserves a life. So just kudos to the theme this year.
All right, thank you. I'll make the observation that I think in the last 3 years, the partnerships and collaborative work that has been developed by our behavioral health department, and I guess more broadly by our Health and Human Services department, I think speaks volumes. As I looked at this proclamation and was trying not to get tongue-tied, identifying all of the different agencies that are a part of this proclamation. I believe there are 11. And I think, as Commissioner Hull indicated, there's certainly many more faith-based organizations and other volunteer groups and nonprofit efforts that are supplementing these fine organizations. So again, when you look back 3 years ago, I don't know that we would have been able to pass this resolution that identified so many partners. And again, I think that is credit to the great improvements in our behavioral health department and Health and Human Services. And certainly, recovery, it's something that can be accomplished. Last time I had a drink, I've been sober since December 7th, 1987. And so it can be done. And again, you've got great partners and people that are willing to provide that support. So if there are no more comments, I will be happy to entertain a motion.
Mr. Chair, I move that we declare September to be Recovery Month in Lincoln County.
And I will second that motion.
Moved and seconded. Any other conversation, discussion? All those in favor say aye. Aye.
Aye.
Aye.
That motion carries. Thank you very much, Sarah. Take care. Keep up the good work. All right. Next item on our agenda is adoption of the consent calendar. These are items of a routine nature or items that have come before the board previously. If commissioners or staff wish to highlight an item, they may do so at this time. Otherwise, I'll entertain a motion to adopt the consent calendar as presented.
I will make a motion that we adopt the consent calendar as it is presented.
And I second the motion.
All right, it's been moved and seconded. All those in favor say aye. Aye.
Aye.
Aye.
That motion carries. All right, moving along, we now have a public hearing, and this is for consideration of the recommendation of the Lincoln County Planning Commission to approve a comprehensive plan map amendment from agricultural land to forest land and a zone change from AC Agricultural Conservation to TC Timber Conservation for the subject property in case file number 01ZCPC20. This includes a proposed ordinance with proposed findings. And this is a land use hearing. So the first thing I'm going to do is open the public hearing. For next, do any commissioners have any conflicts, biases, or ex parte contacts?
None.
None.
And I do not have any. So this is the public hearing for case file number 01-ZC-PC-20 to consider the recommendation from the Lincoln County Planning Commission to approve a request by applicants Kyle and Ashley Humphreys for a comprehensive plan map amendment from agricultural land to forest land in a zone change from AC, agricultural conservation, to TC, timber conservation. Planning staff will shortly go over the reason for the requested change. The subject property is identified on Lincoln County Assessor's Map number 10-09-31 as tax lot 00701. The property is located on Thornton Creek Road, approximately 3/10 of a mile from Crystal Creek Loop, formerly Highway 20. There was no appeal of the Planning Commission's decision and recommendation on this request, but because this matter involves a comprehensive plan and zone change involving agricultural land, the Board of Commissioners is also required to hold a public hearing, which we are doing today. That is why this is coming before us for a second time. The hearing procedure will next be described by County Counsel, Assistant County Counsel Herbage. And after that, we'll proceed to receiving the Planning Department staff. So County Counsel Herbage, anything to add?
Thank you, Mr. Chair and Commissioners. As was indicated, this is back to you just to really cure a technical issue. If there's anyone that's going to want to testify today, everyone would be allowed. The order will be receipt of a staff report and then applicant's testimony, which there may or may not be. Any opponent's testimony, I think we have not received any so far. There could be rebuttal, but there won't be if there's no opposition, and the hearing would be closed. The board could begin deliberations and make a decision. This is unique in that it's come before the board again for that reason. Depending upon what happens today, you do have the option, the possibility of making a decision today, both an oral decision and a written decision. You have before you an ordinance which has the findings attached. So let's see. So I think it's appropriate at this point, Mr. Chair, for the Otto Husing, I think, is present. He would give the staff report and indicate what's in the record.
Okay, and before we do that, I believe we've considered this ordinance previously, or do we need to go through that process whereby reading by title is acceptable?
Yeah, let's do that. Even though this is land use, technically, you know, it's fine to do that. So to the Board of Commissioners, can we read by title only?
Yes.
That's fine with me.
Okay.
Fine with me.
Thank you. It's an amended ordinance amending the Lincoln County Comprehensive Plan map to provide a designation of forest land and a zoning map designation of TC, which is timber conservation, on property located on Thornton Creek Road, about 3/10 of a mile from Crystal Creek Loop, and further identified on Lincoln County Assessor's Map number 10-09-31 as tax lot 701 and declaring an emergency. Thank you, Commissioners.
All right, next, Director Husing from the Planning Department.
Thank you, Chair Hunt, members of the commission. This is Otto Husing, Planning Director. I think I can work through this pretty quickly here. The history of this goes like this. There's a short memorandum to you that I wrote that's in your packet, but I'll say it out loud in case other people haven't seen that and want to get their bearings on where this is. So it goes like this. On February 22nd, 2021, earlier this year, Andrew Bobbitt, the chair of the Planning Commission, signed findings from the Planning Commission on the zone change. It was a unanimous approval by the Planning Commission. And then as we started to move it to the Board of Commissioners, it was discovered that I made an error as the staffer doing the staff report and working on this. And Commissioner Jacobson may know this, but when we, as a member of LCDC, but whenever we do a change of a plan amendment like this, it's called a PAPA, we're obligated to make sure that we share 35 days in advance of the first evidentiary hearing with our state counterparts, a notice, it's called a PAPA notice saying, hey, we're about to change the zone here. This is what's going on. Heads up that we're doing this so you can make sure that we're still aligned with state law. That's what that's all about. And so we didn't do that. And so we discovered, again, we went through the Planning Commission the first time, discovered I did not do the PAPA notice. So I'm taking full responsibility for that. So we needed to go back to the Planning Commission again after we've issued the PAPA notice. So we did that. We went through the Planning Commission. So on April 26th, Chair Bobbitt again signed what was in effect a corrected version of the findings because the PAPA notice had happened. And so then as we took it, we took it to the Board of Commissioners, as Jerry pointed out, but instead of just what you did was just sign an ordinance, pass it, adopting the recommendation. You didn't hold a full evidentiary hearing. With a zone change under our code, we discovered later on that, yikes, we're supposed to actually hold an evidentiary hearing, which this is now. So we're actually holding an evidentiary hearing, properly noticed, where people can contest if they wish. And so that's what we're doing right now. So I hope we're near the end of this. But let me at this point, then let's go back to the fun, very, very quickly what this is all about. There's basically a property. It's a 9-acre property in that little shoestring valley that runs up Thornton Creek Road. And our Planning Commission and our Board of Commissioners decades ago zoned the property in question as agricultural land. But it actually, in the real world, it doesn't have any, it really has no agricultural soils, like only 1% soils are agricultural. Plus it's a timbered hillside. So it ended up getting swept into the other properties that do have agricultural soils along that strip there along Thornton Creek. So one of the reasons the applicants want to change the zoning now from the agricultural zoning to the timber conservation zoning is that if they can do that, then they would be able to apply, and they're ready to apply for a template dwelling. So that's really the reason. Why are they even seeking to go from the agricultural zoning to the timber conservation zoning? Well, it's to get potentially a template dwelling out of it. So here we are. The same facts, of course, apply. There's never been agricultural activities on the site. Under our code, a way to change the zoning, and we don't do many changes in zoning in the rural areas. I please want to underscore that. Maybe that's one of the reasons we've had a few of these procedural glitches. And we don't do many zone changes because you don't do a lot of changes in the zoning out in the rural areas. But one way that you can do a change in zoning is if there's an error in the zoning. So that's at the heart of the applicant's application is that, hey, with the benefit of hindsight and looking at this property more in depth, it probably almost certainly should have never been zoned agricultural to begin with. So please now change it from agricultural zoning to timber conservation zoning. And so, again, they've made that application. Planning Commission was unanimously in favor of it. There's been no opposition. Only one new letter has been submitted for this proceeding today, and it's from the next door neighbor property, actually in favor of the zone change. So rarely are we going to put something in front of you so sort of directly, squarely on a potential zone change as this. What's been rather tortured is the process, not the substance of this matter. So I think I think with that, I would invite Jerry to correct anything that I said in terms of its process. I was more or less asked to handle the substance. And I'd be happy to answer any questions. Again, there doesn't seem to be any opposition to this. Our recommendation is that these people have been waiting for a long time. They've been very, very patient in terms of understanding that there have been a couple of technical procedural errors that we've worked through. And I think we're now poised to be at the end of this. But so, Mr. Chair, I will stand down and be pleased to answer any questions that you may have and turn it over to Jerry as well for the continuation of this proceeding.
Okay, Council Herbage, any question or any additional comments, and then commissioners, questions on staff, the staff's presentation at this point?
Yeah, for the record, Gary Herbage again. I basically agree with the synopsis that Mr. Husey went over, but actually the requirement for the hearing is an esoteric one in the kind of within the Oregon revised statutes in a very confusing place. But anyway, this hearing is taking care of that problem. And the applicants have been represented by a local attorney, Ms. McDowell, as I understand. And maybe if you could just clarify, Mr. Husey, what is in the record, so there's no confusion. And then when we're done with that, I think that Casey, if we can see if there's anyone who is trying to get in to testify or anything, we need to capture those people and their testimony, and then we need to close the record.
Yeah. So, Mr. Chair, just to respond to Jerry's question,
Go ahead.
request of me. So what we have in the record are, is the applicant's submission, the staff report written by me, basically the one letter that's come in. It isn't a large record because, again, this is a pretty straightforward matter. And then I mean, Jerry, are the potential resolutions a matter of the record too, as well, or
the ordinance
looking ahead, right? The ordinance looking ahead. So not a very big record, very straightforward record, but thank you, Jerry, for making sure that I at least ran through what is in the record.
Okay.
Council Herbage, is that sufficient to move forward?
It is.
With our process? All right. Commissioners, any questions of staff?
None from me, thank you.
None from me, thanks.
All right, next this would be an opportunity for applicant testimony, but as I checked the Zoom, I do not see any individuals registered either in favor or in opposition. So I believe that addresses opportunity for applicant testimony, opponent's testimony, and any rebuttal. And if there's nothing more, Council Herbage, I will close the hearing.
Yes.
All right, public hearing is now closed. So this opportunity for the board to discuss this situation and possibly make a decision.
I'm comfortable with moving forward. This seems like about as straightforward a land use matter as we get.
I have a process question. I am comfortable moving forward, but do we need to, since this is a public hearing, I know we received written comment, do we need to check to see if anybody has their hand up in the waiting area to make testimony?
We could see if Casey has seen any.
I have the, assuming the waiting area is attendees, and there are two, Christina Shear and Jane Welch.
Yeah, that's correct. I don't identify anybody present in our meeting outside of this organization.
Okay, thank you, Casey. Just wanted to check.
Yep. Good question. All right, I'll entertain a motion. We have potentially two motions.
Mr. Chair, I move that we approve this ordinance amending the Lincoln County Comprehensive Plan map to provide a designation of forest land and a zoning map designation of TC timber conservation on property located on Thornton Creek Road, approximately 0.3 miles from Crystal Creek Loop, and further identified on Lincoln County Assessor's Map number 10-09-31 as tax lot 00701 and declaring an emergency.
And I will second that motion.
And county council, help me here. Do we need to add that this this is approving the application also in accordance with the ordinance and attached findings that are part of the board packet for this meeting?
Yes, that's correct. Can you scroll down on the ordinance toward the bottom? I just want to make sure something about something. And let's see. Okay, to go up a little bit on the, not the findings, but the ordinance part. Okay, just a second. Yep, okay. I agree with what you said, Mr. Chair.
All right, so if I may, I'll restate the motion to approve the application for comprehensive plan and zone change in case file number 01-ZC-PC-20 in accordance with the ordinance and attached findings that are part of the board packet for this meeting. It's been moved and seconded. All those in favor say aye. Aye.
Aye.
Aye.
All right, and then I will make the second motion, and I move to approve the written ordinance with draft findings as presented.
I second that motion.
Moved and seconded. Any discussion? All those in favor say aye. Aye.
Aye.
Aye.
That motion carries. Council Herbage, anything else we need to do to address this matter at this time?
No, and I thank the board very much for your time on this.
All right. Well, thank you all for your hard work, and thank you, fellow commissioners, for moving along and resolving this issue. So thank you. All right. Next on the agenda is a okay. I have a paper agenda, and sometimes they change. I want to make sure that we're coordinated. Next is a decision on a purchase of a van for vaccination clinics. Interim Public Health Director Florence Portel, are you present?
I'm here. Good morning.
Oh, good morning.
I'm not sure how much detail you want about this. We have been renting a van for our mobile clinic operation since I believe the beginning of June, and we have the funding necessary to actually make a purchase. And the idea would be in order to sustain our efforts and also to acquire a vehicle that would help us in the future with other vaccination events like flu clinics and possibly booster clinics for the COVID vaccine and other vaccines. We might be able to use that vehicle in the future to ensure better access to vaccinations to our community members.
Questions or comments? I guess I have a question. Do we have an idea of the cost and where the funds are being appropriated?
Yes, so the cost, if I have it right, is about $40,000. And the appropriation will be under it will be under the intergovernmental agreement for public health services contract that we have with the Oregon Health Authority. And we have 3 different streams of funding that we could be using for that purchase.
Okay. Other questions or comments from commissioners? I'll entertain a motion.
I'll make a motion that we approve the purchase of a van. Excuse me, let me retry that. My tongue is tied.
We're all tongue-tied today,
That we
Commissioner.
approve a purchase of a van for public health for vaccination clinics.
I'll second the motion.
Moved and seconded. Any discussion? All those in favor say aye. Aye.
Aye.
That motion
Thank you.
carries. All right, Florence. Why don't we just stay with you? And if you're prepared to do the vaccination update, and I'm not sure if Dr. Ogden has joined us or not.
I have.
All right. I'll let the doctor go first, if that's okay with Florence. But I believe Commissioner Jacobson suggested that it might be helpful to have you attend the meeting. And Commissioner Jacobson, any other introductory remarks? Obviously,
thank you.
COVID.
Thank you for being here, Dr. Ogden. I know you're busy and really appreciate it. And I think in the discussions we've had every week about the Delta variant and COVID, I think we see our hospital capacity as kind of that canary in the coal mine. And as I have begun to get your daily updates of that capacity we have, I realize it's not straightforward. There's staffing issues. There's other things that come to play besides just beds. And so I think in part of the discussion we had last week was kind of about this bigger issue about bed capacity and staffing capacity to staff the beds. And so we thought maybe we needed to have you on to sort of explain where we are with bed capacity and what are some of the barriers to that and how our hospitals are hanging on.
Yeah, absolutely. Thank you so much. And happy to speak to those things. So let me start by giving you an update of where we are as of about an hour ago, because we surprisingly made it through the Labor Day weekend looking very good. And then all of a sudden, within the past 24 hours or so, our situation has sort of changed. So at PCH in Newport, we have 21 out of 25 beds full now. We're very tight with staffing on both our acute care unit, where we handle most of our med-surg patients, and in our emergency department. We have 5 COVID positive patients. 3 of those are just on that regular med-surg floor, but 2 are in the ICU. And making it a little bit tight is actually a joyous reason, and that is OB has 2 moms and 2 babes. Yes. Now that being said, it sounds like, oh my goodness, we're getting super tight. We do have a lot of people in the emergency department. We have 12. 2 of those are mental health patients, though, that are on hold, and we are boarding 2 patients until a transfer bed is available. So we have 1 of those patients that is boarding. It's actually pending an admit to our own ICU as soon as one of those ICU patients can be moved out onto the floor. So there's a lot of shuffling. There's some pending discharges. You know, we're holding our own. It's tight, but we're making some magic happen. And as I mentioned before, 2 moms and 2 babies, you know, typically come in and out fast. And so that gives us, you know, some breaks there. And we typically do not count babies in our census unless they are being treated for a situation. So typically it's just the moms who are counted. If we look at North Lincoln, we actually have 17 of 16 beds filled. And that sounds a little strange, but it is because we have 3 moms and 2 babes. And 1 of those babies is being treated, and that's how we get to that 17. We have 3 COVID positive patients there. And our ICU beds are full, but only 2 of those are true ICU patients. 2 of them are also med-surg overflows. And we do have 1 mental health patient boarding in the emergency department. So we are not actively accepting patients for admission there currently, but we do anticipate some discharges over the day today. So as I describe things, they sound tight, right? And they sound like, oh my goodness, if we get 1 more patient, we're just going to go over the top. But let me remind you, this is how we live our lives sometimes even on a normal day. And we we are very adept at moving patients around and sort of figuring things out. Now, that being said, if we get into a situation where our resources outpace our, or the need for resources outpace the resources we have, that can come in a variety of fashions. So how we could see that happening is, number one, if we had overwhelming demand in our emergency department, that could be one of those situations. Or if we had overwhelming demand for inpatient beds, meaning we had patients stacking up in the emergency department and nowhere to put them in our hospital, or an inability to transfer them out to another hospital. Those would be the two scenarios that could occur. If those occurred, we would activate Hospital Incident Command and we would go into a surge situation. And what that means is that we would enact a whole different staffing plan, and we would not be under the typical OHA nurse staffing laws and things along those lines. We would enact a team-based nursing model, which basically means we put our best trained nurse in charge of a pool of other nurses and unskilled hands, and that most skilled nurse only does those things that are required of her to do or him to do, and they assign out the remainder of the task to the less skilled people or the unskilled hands. So they basically get a lot of people to work with. Where do all these hands come from? Well, we would shut down our surgical services, non-emergent surgical services. So we would have not only those people, but that area, both pre and post surgery areas at both hospitals are quite large and can accommodate multiple people. We also, at that point, if we were in that situation, would be shutting down our clinics. And we would be moving all of those personnel into the hospitals to be those extra sets of hands. And so that's how we would surge and get to what we have predicted is up to 150 patients, perhaps cared for in our PCH hospital, and up to around between 80 and 90 capacity in our North Lincoln Hospital. Now that is converting every single area you can possibly think of, including waiting areas, including even some dirty linen areas that just happen to be negative pressure. Some of those closets can be converted. We have a plan to do all of that, but very luckily, we have never gotten there. This whole pandemic, we are still in normal operations mode with our normal staffing plans and being able somehow, some way to handle all of the patients that come to us. And we believe that a big reason why we have not been completely overwhelmed is because of the high vaccination rates that we are seeing within our counties and within our county, and are very, very thankful for everyone's help, and for, frankly, for all of our residents for stepping forward, the vast majority of them, in getting vaccinated, because again, the majority of who we're seeing with COVID positive coronavirus status are those people who are unvaccinated, and those are the ones who are ending up with the most serious cases and needing our ICU care. So I can entertain any questions that you might have about how we might handle things, but again, so far, so good.
Questions or comments from my fellow commissioners?
Well, thank you, Dr. Ogden. I think that was really helpful. I was kind of taking some notes. I'm really, really glad that you have a a surge plan. It's kind of one of those things that glad you have it. Hope we never need it. Scenarios. I guess just the only thing I'd like to say is, about that is, I am hoping that if you feel you are getting close, that we know that before you actually go into that surge mode, because I would hope that my other two commissioners would feel similarly, and that we would make some policy choices in our community if we were, getting really close and you were getting really worried, like I said, I think of our hospitals as kind of the canary in the coal mine, that we would try to do some things to, stop that from happening. And as I watch the stats come through, we go up and down and up and down and up and down. And so it's kind of hard for me to tell, not having a medical background, how close we are sometimes. But I'm just telling you, please let us know if you're seeing a trend, and you think, boy, I don't know how we're going to make it out of this week. I think we'd all want to know that.
Absolutely. And I appreciate it. Yes, I think you're exactly right. If we need to pull that string and really go into a different type of operational mode, we all need to be on board, because we all need to shift our thinking, and that absolutely could impact different decisions. There's one other additional thing that we have contemplated, and that is if we did get into a staffing crisis, such as we could not figure out even how to surge. And the reason I even mention that, and I do not think this will be the case, because again, we are very well vaccinated amongst our employees, but you are obviously all aware that there is a vaccine mandate out there, and many of our employees now are choosing to either get vaccinated, those who are still unvaccinated, to file a religious or medical exemption, or in a very small number of cases to leave. We are trying to wrap our arms around what that looks like this week. We hope to have some estimate by our managers about how many people they think will actually be leaving. And again, we don't think it will impact that many people, because we have 90% of our employees at PCH vaccinated, and 85% at North Lincoln, voluntarily to date. So, and I should add, we are seeing upticks in request for vaccination from some of those remaining employees. So we anticipate having a better idea about how many positions might come open, how many people will be leaving towards the end of this week. But should we get into a scenario that is even worse than our prior, contemplations, we have got the ultimate surge plan, which is to combine 2 hospitals into one, much like we did for the wildfire situation. And that worked on the fly, but enormously successfully. And basically it is to combine our 2 staffs into one. It is not ideal by any means, and we would hope to do things like keep ERs open in both places, but we do have those further surge plans that we have developed, just as we have seen even Delta, change our thinking. So we sort of have surge plans on top of surge plans on top of surge plans, but each reacting to a situation that has become different over time.
Other questions or comments, Commissioner Hall?
Thank you, Chair Hunt. I really appreciate the presentation, Dr. Ogden. I'll really right with Commissioner Jacobson. Glad you have these plans. Glad you haven't needed them so far. And hopefully with the state at or close to the, if OHSU's projections are complete or are correct or close to being accurate, that we're at the forecast time of peak in hospitalizations right now. But his Delta, I think, has taught us all is forecast for the future is absolute. So I will also say I'm totally with Commissioner Jacobson. And if you're even approaching needing to take some of the kind of steps you're talking about in these surge plans, please communicate to us. There may be some things we could do in the policy level that might ease your burden to some degree. Thank you.
Well, I thank you so much for the support, and we'll stay in very close communications.
So I have a comment and then I have a question. Certainly, I support my fellow commissioners in that if we start to get to that surge point or crisis point, let us know, and we certainly would be willing to consider possible actions to help mitigate that situation. Also, earlier in this meeting, we recognized September as National Preparedness Month. What a great example. We've got, plans on top of plans on top of plans. So again, a great example of being prepared. And, we want to be prepared, hope for the best, worst, plan for the worst. So the next, I have a question, and it may be kind of arcane, but I look at the virus and it mutates, and we started out with the alpha, and now we have delta, and I understand mu is a variant that is, I guess, active in some parts of the world. And yet I look at the fact that roughly our best guess is about 85% of the people that are getting sick are unvaccinated. So does that pool of unvaccinated people provide a viable environment for continued mutations, which appear to be getting more deadly as the virus mutates? Thoughts?
Yes, Commissioner Hunt, you're exactly right. That is exactly as I have understood it to be happening, that as long as we continue to have pools of unvaccinated people and even immunocompromised people who have gotten the virus have been found to be sources of some of that mutation, albeit they cannot do anything about that. But right. The unvaccinated certainly can. And as long as we continue to have large pools of people, and in fact, it's much more concerning across the world when we consider, relatively speaking, how well vaccinated we are in the United States versus some of the other countries where, they're facing just single digits of vaccination levels. That those populations pose an even stronger situation for variants to thrive and to form and more mutations to occur. So I think what we're changing our minds about how this ends, meaning, I think when it's all started, we were all hopeful that we would get vaccinated, we would reach herd immunity, this would sort of die out, and that would be the end of this, much like we saw a finite end to like the flu pandemic in 1918. We sort of saw a 2-year cycle. I think we're thinking now that this will be an ongoing battle. And what we hope is that we get enough people vaccinated that our death rates become palatable, much like they do for influenza each year. And each year we might have a season, or we might just see this bubbling along. But each year we might get vaccinated against the variants of variant du jour. While that's
we lost you there, Doctor.
We would, I think, become reality. Oh, okay. And I said just that COVID is here to stay, and we just have to figure out how to better deal with it.
Yeah, I think that's sadly the new reality, at least in relative to that. Commissioner Jacobson?
Yeah, I have a slightly, still on the COVID topic, but a slightly different question. And actually, I have asked a former colleague of mine from the College of Vet Med to come at a future meeting. But just when you think things can't get more crazy, there's been a lot of issues across the United States, but also in Oregon, of people trying to self-treat COVID-19 with ivermectin, which is a large animal dewormer, is my understanding of that. And I guess a question for you, are we seeing, or have we seen overdoses or people using that locally that ended up needing medical help?
Yes, we have not seen people show up to our ER with those particular, signs or symptoms or stories or anything. However, we have seen posters show up around town advocating that somehow the powers that be are restricting people from this medication, that people should be beating down the doors of the medical establishment to demand this this type of treatment. And we have been, of course, scouring our campus, making sure that these things do not stay up, because they are the ones that we have seen are number one, very inflammatory. Number two, completely untrue, but they cite, I use that in quotes, study after study after study that that shows that ivermectin is something that people should be using. And of course, all of these studies are flawed and are not up to the scientific method that we would advocate for. Again, there is no medical understanding in the mainstream that this is anything we should be using. But again, we know that there's at least an underground and undercurrent, even locally, of people who believe that this is the case. So we'll keep our eyes open. We are watching the court cases very closely as well. And we saw that Ohio situation where the hospital was actually forced, at least momentarily, that medication. We're seeing some layout viz. But we have been assured by our in-house counsel that that is not a consideration for us to worry about in Oregon, that what happens there will not affect us, and we will not be under any sort of court order to provide unproven medications or treatments to our patients.
Very good. Other questions or comments? All right, Dr. Ogden, again, our sincere thanks for taking time out of what is ordinarily a busy day, but in these times, extraordinarily busy. Appreciate your great leadership and appreciate the good partnership that the county has with Samaritan Health in all aspects, even inclusive of the COVID, but certainly all around. It's a great partnership and we appreciate it very much. So thank you for your time.
Thank you so much.
All right, and we'll move back to you, Florence. And I know we still have on the agenda the Echo Mountain update, but since we're doing COVID, we're going to stick with it. So thank you,
Right.
Florence.
Yes, you're welcome. Again, good morning. We can scroll down to the next slide, please. So as usual, I like to kind of look at the broader picture for the state of Oregon. So this is the epi curve since at the end of July 2021 until the 6th of September. And what we're seeing here is a slowdown, it looks like, on the trend line, and possibly a trend coming down. So we'll have to see if this holds over the next couple of weeks. But yeah, that would be wonderful news if this surge were to be peaking at this time. Next slide, please. So similarly, for the COVID-19 hospitalization in the state of Oregon. So remember, we've had this really steep trend line since kind of like the beginning of July of this year, and we've almost made it to 1,200 COVID-19 positive patients being hospitalized in Oregon. As you can see over the past few days, it seems that the trend is not as steep as and that it possibly is also coming down. So hopefully that is going to hold as well. Next slide, please. So this is, the numbers as of yesterday, and as shown on the previous graph. As of yesterday, we had 1,140 people in the hospital with COVID-19, and this is 22 less patients than what we had last week. So this is encouraging. Out of those 1,140 COVID patients, we had 300 who were in the ICU. Last week, we had about 28%. So we're decreasing also here in terms of who is in the ICU. And we are seeing a little bit more bed availability. I think we're again 2 to 3% on both adult ICU beds and the non-ICU beds. So as a reminder, and like Dr. Ogden was discussing earlier, we are definitely seeing the majority of cases who are being hospitalized are people who are unvaccinated. And even though we're seeing a little bit of an increase among people who are vaccinated, with this blue line, as you can see, the number of hospitalized vaccination patients is remaining pretty low at this time. Next slide, please. So, and Dr. Ogden, if you want to talk to this slide, you're welcome to. So pretty much what we've been doing is trying to track a little bit what's been going on and try to see if we're seeing a trend. The trend we've been seeing, in terms of, and so these are only, of course, COVID-19 hospitalizations in our county. And we're looking at a time frame from the week of July 4th to this past week. And this, we're definitely having an upward trend in terms of COVID cases. And out of all of our hospitalized cases, 84% of them are in people who have not been vaccinated. Next slide, please. So then we looked at age categories, and we're now seeing an increase in the younger folks. So as you see, we have one case in their 20s, and we've had about 10 cases in their 40s, and then the other population that has been hospitalized is the 80s and older. And same time frame, the past 2 months. Next slide, please. So I kind of wanted to give you, I'm sorry for the typo. It's not the proper name for the hospital. So, and Dr. Ogden, please correct me if I'm wrong. North Lincoln County Hospital, 16 inpatient total bed capacity, about 4 ICU beds when they're staffed. And as of this morning, from the data that was discussed earlier, you were at capacity for ICU beds, and 3 COVID positive patients were in the hospital. And at PCH, 25 bed inpatient adult ICU beds between 5 and 6. And as of this morning, the ICU beds were at capacity, and there were 5 COVID positive patients in-house. Next slide, please.
Florence,
So-
you've got to count that baby at North Lincoln City. That's how you get 17 out of 16.
Yes, there you go. So this is what I try to do to show some type of trend, and those are numbers directly from the hospitals. And I've only focused this graph on COVID positive patients and then ICU beds, and the red horizontal line discusses the kind of like the full capacity. But as discussed earlier by Dr. Ogden, there is a lot of flexibility and plans in place to ensure that this capacity can be moved and increased as needed. The trend line is really looking at the COVID positive patients. And as you can see, it's a trend that is going up, not surprisingly, based on the other numbers we've seen. Next slide, please. Similar trend for North Lincoln Hospital for COVID positive patients for the month of September. So those 2 graphs are for the month of September to date. Next slide, please. Okay, so where are we at? As of yesterday, we've had 2,525 cases reported to us, 112 hospitalizations, and 30 deaths. Our incidence rate is going down a little bit. We're now at 451.3 new cases per 100,000 in the last 7 days, and our test positivity is decreasing a little bit as well. We went from 28% to 20%, which is a good side, but still really high. We have a total as of yesterday of 176 cases of COVID-19 that have been reported to us. Next slide, please. Okay, so what can we do to slow the spread down? Getting vaccinated is would be the preferred step to be taken. If you can't get vaccinated, being sure to wear your mask properly over your nose and mouth when you're in public indoors and outdoor setting. Limiting social gathering and maintaining physical distance. Of course, washing your hands on a regular basis and staying home when you feel sick. We were looking at the breakthrough cases just to put things a little bit in perspective. As you can see in this graph, this is kind of like the rate of COVID cases by vaccination status. The yellow dotted line is the people who are not vaccinated and who are case. And the gray line are the people who are vaccinated and who are case. We looked at our total breakthrough case and kind of looked at our the proportion of those cases from the time the vaccine became available, and it's actually quite low. It's 12.4% of cases in our vaccinated population since January of this year. So really, the epidemic at this time is very much within the unvaccinated population. Next slide, please. Okay, so our trend for vaccinations, you could see a little uptick that we had talked about those past few weeks in August, and it seems to be coming back down. So we'll have to see what it does over time. We're still offering quite a bit of options to the community. Next slide, please. As you can see, we're doing still really good. We are, I think when I looked yesterday, we were either number 3 or number 4 in the state for overall vaccination rate. We're at 78.1%, which is remarkable, really. And we are usually between 0.5 and 1% of change over the data we had seen the previous week. We compare still really well to the state vaccination numbers. So this is really encouraging, and we're getting way closer to the 80% benchmark that had been set up by the Oregon Health Authority. Next slide, please. So as usual, we have vaccination clinics going on. Of course, people can get vaccinated at pharmacies, in primary care offices, and we have public health mobile clinics still going that we are organizing in partnership with a lot of community members, partners, organizations, businesses. If people are interested in having us come and provide vaccination to their location, the form is available on the county website under the testing and vaccination link. So those are some of the events that are happening this week and next week. Next slide, please. Any questions?
Commissioners, questions?
Chair Hunt,
Commissioner Hall.
much appreciate the update. And Florence, I guess my number one initial takeaway, and please correct me if I'm wrong, is that there's a little bit of reason for confidence and a little breathing room. Certainly, we don't want to read too much into it, but I feel more encouraged than I have in many a Wednesday.
Yeah, I think I hope so. We're gonna keep on looking at the data pretty closely. Delta has been apparently seen to be peaking and coming down after about 2 months. So we'll see if it holds this trend.
Commissioner Jacobson, we're all tongue-tied today. Commissioner Jacobson.
No additional comments. I'm just, similar thinking to Commissioner Hall. Cautious optimism maybe is the best word I can describe it. And, especially with schools just starting here yesterday and today, hopefully that continues.
Right, and I also wanted to mention, and pardon me, I forgot this earlier, we are aware of some of the difficulties of getting tested for COVID in the community, and we are working with the Oregon Health Authority and Willamette Valley Toxicology Laboratory to offer testing opportunities, free testing opportunities at our vaccination clinic. So most of the clinics that I showed on the slide earlier will have a testing opportunity at the same time, where we're really trying to make it easier for people to get access to this resource.
Thank you, Florence. I'm happy to hear that, because I think testing, especially as we saw that pick up, it became more difficult to get testing, and having been through this with recent personal experience, it was difficult. And especially with some of those free community testing events are not, they're not every week. And so if you're on kind of that off week, then it's more difficult. And there was still a lot of, it was difficult for me to figure out. And so I can't imagine the difficulty for people that don't have a primary care physician or don't have insurance, or English is a second language or what have you. So I'm glad that we're continuing to work on that.
All right, I would just note too that the website has the very comprehensive list of sites that are offering vaccinations. And my understanding continues to be that really any of those sites will welcome walk-ins, or most of those sites, if not all. I think, to quote Dr. Ogden in a prior meeting, she said, they'll grab people off the streets to stick a needle in their arm. So the availability of the vaccine is good in our county, and my understanding too is that the supply of vaccine is very adequate, or in the county too, plenty of vaccine. So thank you, and I will say there is reason for hope, and let's hope that those trends continue. It's a little early to say we got through the Labor Day, but at least Labor Day is behind us. We've got, well, Halloween, Thanksgiving, and Christmas holidays ahead of us, but let's hope we're on a downhill slope that continues. So appreciate all your hard work, Florence, and those of your staff. Thank you very much.
You're welcome.
All right, we're going to jump back in the agenda for an Echo Mountain fire update. I don't know if PIO Miller has information. Commissioner Jacobson, who has an update?
I think as usual, it's going to be kind of a tag team approach, but I will kick off. And this week is our 1-year anniversary of the Echo Mountain fire. So everyone should just kind of be aware of that. And, we're not all back together yet. There's still a lot of people living in hotels and a lot of barriers for people to get back home. So I think for those of us that didn't lose our properties, it's kind of easy to think we did that, we're done. It was a year ago, but there's still a lot of people in our community in limbo right now because of that. And recovery is, as I'm learning, not a sprint, more like a marathon, and it's exhausting. And I'm doing it more of an administrative level than I am a personal level. So just wanted to remind everybody that it was a year ago this week that happened. Also wanted to say that, we often say that we did not lose anyone in that fire, and it's true that no one died of the fire itself, a fire, but there's a family member or a family that does feel like their family member did pass away due to the fire and the circumstances surrounding that. And my understanding of the situation is that during the evacuation, this person fell and had a head injury while they were trying to evacuate, and then died a few days later of that head injury. And so I just want to acknowledge, that family, and they do see that loss as connected to this event. So just want to acknowledge that the community does feel like there was someone that was lost, not by fire itself, but in the chaos of that evacuation. And then lastly, if County Council Yule is present, she actually had a call last week with some housing developers from the state that are looking to do using some disaster credits to build housing for some people, survivors that are not able to go back home. Many of them are renters, for example, or don't have resources to rebuild. So I was not on that call, but she was, and I was hoping she could maybe just give a little bit of an update on what the state is maybe thinking doing and how that might help.
Council Yule's present, but she may be occupied.
No,
here she comes.
All right, and I put her on the spot, so.
No, she's here.
Hi, I'm here. Are you talking about just an update for our meeting with the state folks, or what did you?
Yeah, I mean, just kind of, I don't think there's been a lot of, public talk around the fact that there may be some housing resources developed. And I think for those people sitting in hotels a year later, it might just be a little bit of hope that maybe at some point they'll be able to have a more permanent resident. So.
Yeah, so I can tell you we did have talks with, his name is Tom Kemper, and right now we're looking at doing basically senior housing. And so this would be a location, and it would be around 60 units that would be developed for seniors in the Lincoln City area. I know they're partnering with Jackson County, their housing authority down there. And they're also going to be looking at some senior development and some housing development in general, just because that area was hit so hard. And so I just want to get your thoughts, commissioners, on if we did move forward on helping with an RFP, we would not be the ones who would obviously take ownership of this facility. My understanding is eventually it would be transferred to the Housing Authority and they would run it.
Commissioners, thoughts?
Mr. Chair,
Commissioner Hall.
it sounds like this is worth exploring to me if we can play any kind of role in facilitation of getting some badly needed housing development up and going, then I'm for it.
Yeah, I would add that I'm for continuing the conversation as well. And, you know, we are pretty strapped internally right now. And I would hope that the state, you know, if we did the RFP, could provide a, I don't know even what you call it, a manager, an organizer, somebody that would kind of, you know, manage and carry that project over the finish line for us so that, you know, we could have some help kind of lifting that project forward. So, I think more conversations are needed to kind of sort out the details, but generally speaking, I'm supportive of making sure that that project can move forward and that, you know, that the lack of partnership isn't the barrier for them to be able to do that.
Yeah, I would just add that I think to some degree, County Council Ewell, if you feel the staff has the time and the county has the resources, however, it's appropriate for us to be involved, frankly, in any project that will add housing in our county, I think is worthwhile. So certainly support the concept and encourage continued dialogue. And as long as we have the resources to be able to participate effectively, sounds viable to me.
Okay. Well, let me follow up on some timelines. I know that the Housing Council is to meet regarding these funds that are going to become available. So I would like to take advantage of that and make sure we're, you know, meeting the deadlines. So let me get some more information and I'm going to report back at our next meeting next week, and I'll have a little bit better idea of timelines and what's involved.
Very good. Other COVID update?
Wildfire update. Casey, do you have anything?
Oh, okay. I thought we might be pivoting here. Hey, just a reminder that
Maybe I should just turn off my camera and start over.
it's all right.
Yeah, we are on Echo Mountain wildfire. Sorry.
Yeah. Just a reminder, we still have our North Lincoln Rebuild section of the website where we update what's happening now in regard to recovery. You can see that septic and water system repair assistance program there that Katie's been working so hard on. And one note here, we've got a new deadline, and I know this is kind of confusing on debris management task force stuff. They have put a final deadline of September 15th. So you can click on the link here and access information. If for any reasons folks out there have not taken advantage of ODOT's opportunities to do that, that deadline is coming of September 15th. So we continue to update the website with information. Yeah, and you know, this weekend was interesting for me. We, emergency manager Damaris and I did an interview with KLCC about the anniversary. And of course, the anniversary event was postponed for the wildfire survivors to tell their stories. And I just, you know, I felt like when we started to tell our stories as responders to this news reporter, he might have gotten more than he bargained for. So I've been meaning to listen to it and see if he could actually pull out some usable material from just reliving the wildfire itself from our perspective. And I know there's just, you know, so many, there's as many perspectives as there are individuals. So I appreciate the work our organization has done, the support of the commissioners to, move the community forward. Folks can still look at the website, and we'll just keep working on it. And when we get more into that recovery visioning, details about that will be here as well. So yeah, it's been a year. It's pretty amazing. That's all I have for you.
Thanks, Casey. I guess the last thing I was going to say, and I forgot to earlier, is the last week of the legislative session, they had a very large bill passed called the Christmas tree bill, which was both state and federal funding, ARPA funds. We had several requests into that for wildfire recovery. About roughly 16 million was passed for Lincoln County for wildfire recovery. I was working very hard on trying to find out, when that money would actually get here. And I was told it would be here December, but sometime between December 2021 and June 2022. Which isn't super helpful when you're trying to actually get some things done for recovery. But last week, I actually got emails from the state with our official award letter and draft contracts for us to receive that funding. So December, because it takes a couple months to get all that stuff through. But the good news is that I think that money is clearly going to be here before June. So that's kind of the first step in the process to get that. This gives additional money for septic and well water programs. So there'll be another flush of funds into that. And then there's also money from the money we're receiving that goes over to Panther Creek Water District to get fire hydrants up to code, fix some of the roads. As we're doing that, it's not road money per se, but when you put new pipes in, you've got to rip up the roads and then put them back together. And then additionally, there's some money for secondary fire suppression systems using gray water and that kind of stuff. So just kind of exciting that hopefully those resources are going to make their way here.
Yeah. Keep plugging away.
All right, thank you. And I think, the good news is looks like there's money coming, and it's a long process, but we continue to move forward. So thank you, Commissioner Jacobson and PIO Miller. All right, we're still in reports, but this opportunity for commissioner reports. Commissioner Jacobson, any reports?
Can't get off mute there. Sorry, nothing additional to report.
Okay, Commissioner Hall.
Nothing to report, thanks.
And I have nothing to report. So next we'll move to public comment. Last time I checked, there was nobody in the attendee category other than our own finance director. So unless I missed something, Mr. Miller, I assume that's where anyone that signed up during our meeting would show as a potential public comment.
Yeah, and I believe we had, correct. I'm sorry. I'm looking at the website. Yeah. No individuals have joined us in our meeting today. Yeah.
All right. And on the website, we have some public comment.
We did. Yeah, we've got it right here. And just jumping over to the smart sheet is, oh, wow, I lost it. So stand by, looking at our smart sheet on public input. Yeah,
Okay.
just one element that came in today. So
all right. Okay, so that covers public comment. Next, we will be entering into an executive session, but before that, we have a special Board of Commissioners meeting scheduled tomorrow, September 9th at 1 p.m. That is a public hearing and an ordinance reading. We have a joint work session with the City of Toledo City Council. That is Monday, the 13th at 5:30 p.m. We have our next Board of Commissioners meeting on Wednesday, September 15th at 10 a.m. And also on that day, we have 2 executive sessions, one at 1:30 and the second at 3 p.m. All of those meetings will be held virtually. And we will now recess into executive session under ORS 192.660, parentheses 2, parentheses H, to discuss litigation. We will not be coming back into public session. So we are now in recess for the executive session. Thank you all for your participation and attendance.